right? Next, we'll see the biomarkers of CKD. Again, there is overlap. So cystatin C you have. So as I said, you can use just serum cystatin C calculation or to calculate EGFR, or you can use combined creatinine with cystatin C values for calculating EGFR. So when you use only serum cystatin C less than 60 ml per minute per 1.73 meter square value itself tells that there is some you have to you have to think about CKD. Yes. And if you're using both the values, even less than 85 ml per minute per 1.73 meter square you have to suspect. Okay, you have to suspect any kidney injury. You have to suspect the progression or the CKD stages in these patients. And especially this is being useful in, the patients who have undergone cardiac surgeries. Okay. The second marker is beta trace protein. Beta trace protein, this is a lipocalin type prostaglandin D2 synthase. And this is useful in finding out CKD progression, right? And then you have NGAL, you can use it as a marker of CKD. So this can be used as an early marker, even in, yes. So even in diabetic nephropathy, yes. So snake bite, nephrotoxicity. So in these cases, the NGAL is actually a early marker. Not just that, even in CKD progression, you can use this. Then KIM1 molecule you can use, liver type fatty acid binding protein we can use, microRNA we can use. So as we said, so next is asymmetric dimethyl arginine. This is actually a reversible inhibitor of nitric oxide synthase, and because of which nitric oxide levels are reduced, that will lead to endothelial dysfunction and kidney damage. So this is so this molecule is involved in the pathology of the CKD. So you can use this to find out CKD progression. Next biomarker is uromodulin. Uromodulin is nothing but Tam-Hirschfeld protein. Yes, this is a tubular protein that we had learned, right? So this one, when CKD is associated with interstitial fibrosis and tubular atrophy, the levels of this uromodulin will decrease. So this basically tells us about the intact renal mass. Damn the kidney function, this uromodulin will tell us about the intact renal mass. So these are the different biomarkers of CKD. So thus we had learned newer markers of AKI and CKD. Okay. So hope this is useful.